My name is Christine Heisler, and I am a female pelvic medicine and reconstructive surgeon with the Spectrum Health Medical Group in Grand Rapids, Michigan. I would like to discuss our article, Complication Rates between Local and Referral Patients Undergoing Vaginal Hysterectomy at an Academic Medical Center. This study is being published February 2010, Volume 85, Number 2. This study was a planned secondary analysis of an initial study that was sufficiently powered to detect small differences in serious but infrequently occurring complications. We reviewed electronic medical records of 732 women who underwent a vaginal hysterectomy for benign indication from January 1, 2004 through December 31, 2005. Women were separated into two groups based on home address zip code. Women who resided in Olmsted County, the location of Mayo Clinic, or the surrounding 6 counties were considered local patients. Those women who resided out of this 7-county area were defined as referral. In total, 361 women, or 49%, were referred to Mayo Clinic. Referred patients were older, had lower body mass indexes, and were more likely to have associated cardiovascular disease, including prior myocardial infarction. Referred patients were more likely to have an American Society of Anesthesiologists score of 3 or 4, have associated pelvic reconstructive surgery, and longer hospitalization. Despite these differences, women referred to Mayo Clinic for vaginal hysterectomy were no more likely to have a complication than community-based women. Even after separating the cohort into women with and without additional pelvic reconstructive surgery, no differences in local and referred patients were found. Approximately 180,000 vaginal hysterectomies are performed annually in the United States. It is a procedure that most gynecologic surgeons are comfortable completing with relatively few contraindications. However, women may be referred to a tertiary care center due to significant associated medical comorbidities, unusual pathologic process, or requirement for additional procedures beyond the scope of a given gynecologic surgeon's practice. The need to be referred to a tertiary care facility should be based on dialogue between an individual patient and her surgeon. The general assumption is that referral bias equates to worse outcomes for patients who are referred to a tertiary care center. This is untrue. Referral bias simply implies inherent differences between community-based patients and those referred that contribute to a difference in outcomes. Furthermore, the direction of referral bias can vary. Patients referred for care may have better or worse outcomes than community-based patients. Therefore, not only the presence of referral bias, but the overall impact on outcomes should be delineated. Determining the effect of referral on surgical outcomes is an important but often overlooked aspect of outcomes research. In this era of surgical quality improvement, investigators must assess for referral bias in order to make meaningful interpretation of a particular study's findings. Although risk adjustment attempt to account for baseline differences, it cannot negate the presence of referral bias. Furthermore, underlying medical comorbidities and preoperative risk factors may be associated with increased rate of complications and longer hospitalization, which may also affect reimbursement for referral centers. While this doesn't directly impact patient care, it has far-reaching implications for healthcare policy and must be considered in the overall evaluation of surgical quality.
We hope you benefited from this presentation based on the content of Mayo Clinic proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.